This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Tonight we're going to talk about how to avoid the epidemics of diabetes and Alzheimer's. And we've invited once again Dr. Daniel Beilin from California. Thank you, Dan, for coming to join us.
You're welcome, Jackie. It's good to be here.
Dr. Beilin is a doctor of Oriental medicine. He's also a licensed acupuncturist. He practices in Aptos, California, and here in the Boston area. Dr. Beilin specializes in developing programs for his patients that involve nutrition and lifestyle. And he also specializes in diseases such as diabetes, brain dysfunction, men's and women's health, and oncology. Dr. Beilin has been in private practice for over 25 years, and he has a liaison with clinics in Europe who have been specializing in treating cancer. So Dr. Beilin, our topic tonight is quite unusual because no one would ever think that there is a connection between diabetes and Alzheimer's. Can you explain what they have in common?
Well, as we discover more and more about what's the true cause of many diseases, we find that inflammation on a systemic level, not just of a particular organ, but whole system inflammation, which can be measured fairly easily with some blood tests, have a lot to do with how our cells receive insulin, which is produced by the pancreas, but also whether there's inflammatory surround to the pancreas, which controls blood sugar. Blood sugar has a lot to do with our brain function, the ability for us to kind of like listen to a person talking to us when there's a crowd and a noise around it, and to focus on that has a lot to do with glucose metabolism in the brain. And in overall body inflammation over a long period of time has been linked to many cases of Alzheimer's now, because there's a problem that develops in the blood-brain barrier, and certain things that are infections that are in our systems can get through, whereas before they were siphoned off and prevented from getting to the brain.
So what is diabetes? Why is it so common today?
Well, you know, about 20 years ago, when I was in Germany studying, they talked about that there was a whole number of years that a patient would have a developing diabetes, but they wouldn't have glucose in the urine. Their glucoses were still within normal limits, and they said, no, you don't have diabetes then. Well, in Germany, they were saying, no, there's an epidemic of pre-diabetes. And then about 7 years ago, I was watching TV here, and lo and behold, they say, oh, well, we have a new disease now. It's called pre-diabetes. And now we have this, of course, we use this test called the HbA1c test, which tells us something about how insulin is being received by cells of our body. And when that goes above 6.0, then we have at least a pre-diabetic or a diabetic picture. So then we wanted to figure out, is there any pattern to the pre-diabetic state? So we can stave this off, reverse it before a person requires drugs, and we can work with the nutrition. And we noticed that as we reverse these trends in the body of diabetes, they often have inflammatory markers in the blood. One of them is called a C-reactive protein, or CRP, in the slang, and you can go to your doctor and ask them to request from a lab, I want a CRP, I want an anti-nuclear antibody called an ANA, and I want a sedimentation rate, which is a test done with knowing what percent and how your blood cells fall in the serum they're in, which also is an inflammatory marker. And so we begin to see, okay, well, if we have a person that walks in and they have generalized inflammation in the body, which is reactions to something, then we'd start to look and say, okay, well, you have reactions to something, what could it be? And this is where we can start to look to see where are the inflammatory indications and inflammatory characteristics that can cause a slew of diseases, but we are finding that in diabetes and Alzheimer's, people almost always have an inflammatory history.
What about what is Alzheimer's disease?
Well, there's different theories and known things about Alzheimer's. And then there's the neurological cases of cognitive disorders that are called Alzheimer's, but are not actually Alzheimer's. So we have to make sure, of what we're speaking of. The most prevalent and the real Alzheimer's is a dispersive whole brain effect of these amyloid plaques, they're called. There are certain proteins that are laid down all over the brain that start to block cognitive function and overall neurological function. There's many theories about why these plaques have formed. There's some that there's a bacterial infection that got through the blood-brain barrier that produces these plaques, and we've done studies with certain bacteria form similar plaques like E. coli. And there's some that believe it might be a virus, that, like chlamydia. That's been taken in and thrown out, and others believe that it could be heavy metals. Others believe that it could be a fatty acid metabolism problem because fats are so important to our brain. Mm-hmm. But real Alzheimer's has to have these amyloid plaques that are identified by an MRI or a SPECT brain scan. Now, in the people that have what appears to be Alzheimer's, that has to be very carefully differentiated. Many people that are called Alzheimer's had blood pressure problems, especially with a high systolic. You know how you have your blood pressure 120/70? Well, the high number, the 120, if that's at 140 or above, and the lower number is normal, that is a case where there's mechanisms within the brain that shut down circulation to the frontal lobes, so that on a SPECT scan you can see the diminishing activity of the frontal lobes, and it'll act like Alzheimer's, but it's really due to long-term metabolic problems having to do with blood pressure and also endocrine function, hormone function. So these have to be carefully understood. And there's a lot of things that we do when the first stages of cognitive disorders happen, then we can be more effective with natural medicines at that point rather than advanced cases.
Okay. And what is the nature of inflammation? Why does it start?
Inflammation usually comes from one of two things. Either there's an infection, like a bacterial infection, that causes the body's immune system to react, and the reaction of histamines and other reactive immune displays and reactions cover, it goes through your blood, it goes through your lymph system, and it forms an inflammation to mucous membranes. That means everything from your mouth down, the whole digestive tract and your skin. This is inflammation. They can come from an infection. That could be a low-lying infection, you might even not know, but the body sees it and it reacts. The other is from different agents, like in the environment. Creates like sinus problems, hay fever. Those are inflammations of this upper part of the respiratory system. And the most prevalent with all of us, and these are inflammations that are all coming, is from dietary reactivity. Because as our food is changing away from how it was once given to us, like say take wheat. Wheat in Italy is not the same wheat that we have here. And therefore, there's much less allergy to wheat in southern Italy than there is in the United States.
What do you mean by it's not the same? The way it's farmed or the way?
The actual grain is a primitive grain, in especially Sicily and southern Italy. And that primitive grain is of a species that's different than the grains that we're getting here, either from other parts of Italy or from made here. Wheat has other chemicals in it that are causing us to have these allergic responses. If you have some kind of bread or something, pastry or something, more than 2 times a week, you're going to generate an inflammatory chemistry.
getting into wheat and other foods, what role does diet have to play in inflammation?
Well,
how would you work?
Okay, so what are the most allergenic or inflammatory foods? They are wheat or gluten. They are cow dairy products, cow cheese, milk from cows. So I have every one of my patients substitute with non-gluten, which there's plenty of breads now with non-gluten, gluten-free. Their whole body changes. They'll feel the change. And especially for children, any child that has chronic infections, tonsils or allergies or any kind of digestive problems, if you take them off all cow dairy products, you will see substantial changes in 70%. So our diet can be and then less sweets. So sugars allow for more of our intestines to have more yeast, and more yeast is always generating something called mycotoxins that are inflammatory excretion elements from these yeasts, and those cause systemic inflammation. And this is something that should be calmed down in everybody. And when this happens, when you change to a more vegetarian diet, when you alkalize your body by juicing and taking more vegetables, or you can take a little bit of bicarbonate salts, even something as simple as Alka-Seltzer Gold, which is only the bicarbonate salt with no aspirin. This is something that can help to alleviate a lot of problems, heartburn, regurgitations, and digestive problems. Of course, taken away from food because you don't want it to interact with the normal hydrochloric acid of the stomach. Mm-hmm. So you can take it like before bed. And I have many of my patients doing this.
So what are some of the main, just outline briefly how you take care of your patients who have diabetes, and also is for children as well?
Well, diabetes type 2 is adult onset.
Right.
Type 1 is more complicated and requires, usually insulin. There's not much we can do about that. But for adults with diabetes or pre-diabetes, exercise, of course, and then we have numerous herbs and substances like chromium, the mineral chromium. If you just take that alone, 200 micrograms with every meal diminishes your desire for sugars, and it has an ability to increase the absorption of insulin by cells, which can reverse the amount of glucose that's circulating in the blood, which is staving off a diabetic state. So I use chromium, I use a couple of herbs, like there's a new one that we're using called banaba, there's another one called gymnema, and also cinnamon is very, very good to increase the absorption of insulin by the cells. So we put them on a program where the most important meal, and you have to have people eat more protein in the morning and in the lunch and less in the evening. And this is something that helps to regulate cortisols from the adrenal and insulin throughout, and the balance of glucose throughout the day, so they don't get tired and they have much better energy reserves that burn fats better. So that's what we do for prediabetes and diabetes.
And for prediabetes and diabetes, you talked about being able to diagnose it or be suspicious about it by looking at things in the blood test. But you also have a patent for a new thermography that detects diseases years before symptoms manifest. Is that also a way where you're able to detect diabetes?
Yeah, we found a huge correspondence of patients who have diabetes or have elevated A1C tests with a certain pattern that we can see in this dynamic thermography. It's not the infrared camera method. That doesn't show it. You have to take two tests and look at these certain points that are projections through the autonomic nervous system that connect to the organ. And when you look at these 2 points, they appear very, very cold in relation to the rest of the points of the body.
You're actually taking temperature readings 2 times.
Yes, on the skin before and after you subject them to a stress that allows us to reflect the body's own ability to cope with stress, which tells a whole picture of physiology which we have a very high correlation of results that correspond
to points seem cold or warm or
well, the first point of the test is very cold and it stays very cold, so that's the signature of a potential insulin resistance. We can't rely on that 100%. Right. Then we know what test to do. So now we're going to test your A1C and see if that's abnormal, and then we have a huge correlation and develop studies based on that.
And is that also true for Alzheimer's, where you're able to detect patterns in the thermogram, this new thermogram as well?
For Alzheimer's, it's a little different because the first signs you usually see are slight cognitive disorder, and it's very, very difficult. Even if you were to do a functional MRI, you can see some of these things that might be plaques, but it might be too small even though you have the cognitive dysfunction. So in the head points of the thermography, we're actually, I've just created a device that allows you to read through the hair. So it's using a very close proximity infrared, but we're doing it in a dynamic way, like the skin temperature that we were talking about. And we're going to work with a radiologist to look at imaging through SPECT and MRI and correspond this to the new points through thermography that we can get. But we do know that there are toxic substances that we do find often with people. That's a heavy metal toxicity. And the person has been exposed to chemicals like pesticides, and also a history of hormone imbalances like estrogens and thyroid imbalances. So we hope to correlate much more of this in the future.
And what are the best things to keep our brains functioning well and to help them to continue to develop as we grow older? I mean, some of us, as we grow older, we might have some cognitive dysfunction or maybe a little bit of memory loss, and it's a little nerve-wracking. What could we be doing to help prevent that?
Well, I used to know the answer to that question. Wait, let me think. So, one of the greatest researchers is Daniel Beilin. He's a neuropsychiatrist from California, and he's done more SPECT brain scans than anyone, and probably about 1,000 times more than anyone. And he has some great books out that tell you exactly how you can prevent cognitive disorder and Alzheimer's. One of the most important things that we know is the brain is mostly in good health when it has enough fats feeding it to keep the axons surrounded with the fatty sheaths called glia that help to furnish our impulses to work fast enough. And fish oils are the #1 thing that everybody needs to take that are not only anti-inflammatory, but they also protect the brain. So fish oils is #1, and most people think, okay, well, go get some fish oils and take 1 capsule a day of like a 500 milligram. That'll just sit in your stomach and coat maybe a piece of your stomach. You really need to do at least 4,000 a day, which you get the larger pills, and you take 4,000 to 6,000 a day. So the first thing is fish oil. The second thing is CoQ10, coenzyme Q10, brings oxygen to the brain. The third thing is ginkgo, and there's a few types of ginkgo. There's a new type they've discovered that works a lot better than the others. I believe it's called ginkgo, something like E65. And now they're showing it on the bottles whether it has that form of ginkgo. There are a lot of brain protective formulas out on the market. Most of them are fairly good. However, you should check the companies for their quality, because if you just find this at something like one of the big stores, whether it be a drugstore or like a big company store that
Discount
does other
store
products, I don't buy from them. You should either buy it from somebody that's really knowledgeable in these fields, or from health food stores that are carrying a higher quality, especially of fish oil. How the drug companies came up with a prescription fish oil. Well, how are they stabilizing it? How fresh is it? And they say to take 1 a day. That's not going to do anything. What's going to happen probably is they're going to say, well, that's not been working, so we went back to the drugs. They always tend to do things wrong when they actually try to get into the field of nutrition. I think we have our place and they have our place, and we should be able to work together. It's my feeling.
So that would
about it.
be cod liver oil or the Arctic krill.
Yeah, krill is very, very good, but very expensive. And most of the good fish oils are taken from sardines or anchovies, and they're taken from the area of South America, off the coast of Chile, or they're taken from Norwegian, sea waters. So, you have the most popular companies. They should be tested for heavy metals, because fish like tuna is full of heavy metals. And I tell all my patients, okay, we're going to test your heavy metals, and here's what the things I don't want you to take. And half the varieties of fish have heavy metals. Something else for preventing cognitive disorders is something called vinpocetine, or there's an extract of hops that's working very, very well. And of course, getting enough sleep and doing mind exercises a little bit every day. Dr. Amen speaks about how vital ping pong is.
Yeah.
And it turns out that many, many very talented people till their elderly age have ping pong habits. So there's something magical about ping pong. I don't know what it is, but to use your brain and to be always creating. If you play a musical instrument, keep playing it. If you do crossword puzzles, keep doing those, because the more you use, the more the brain grows. And there's proof now that elderly people still have the possibility to grow new pathways in the brain, and they should never stop growing those pathways. Take up a new language, go to a course at a college. Any of these push the brain to actually systemically in the whole brain system be more alive and be more well fed to the last days and be clear in thinking. Can
you tell us how doctors might be able to identify factors in Alzheimer's a little earlier than they're already doing?
Yeah, well, it brings back a recent memory of my mother going through a system of orthodox medicine and a big HMO that she was part of, where she had a high systolic pressure, she like 145/70, that was only being treated with an aspirin a day. And her doctor felt like that was enough, and it was that since the diastolic wasn't high enough. Well, good cardiologists know that that's not right, that is a symptom of high, it's an indication for hypertension. And what this does long term is it shuts down some of the circulation to the frontal lobe, some of the blood circulation, because it's a compensating mechanism of, there's too much pressure, I better calm it down. And it's not a problem of the brain, but the brain and the systems that control the circulation actually take the oxygen away from the frontal parts of the brain. So this was happening for a number of years with my mother. She had hormone deficiencies. She was not she had a thyroid problem. She had a thyroid deficiency, and it was not being managed. It was not even being looked for. And then she was noted that she had cognitive disorder, and they check her blood pressure and says, well, that's okay. So let's just start giving her the drugs, which they use their stimulants to feed acetylcholine, which is only one transmitter system out of about 10 that we can treat without any kind of testing. They just give this to people that look like they're developing Alzheimer's. They do a brain MRI. Not all neurologists even look at the brain MRI. So there's little spaces of blindness that are being used. And if you do treat in an early phase, and I started doing this with my mother, giving her a high-dose CoQ10, giving her fish oils, giving her some neurotransmitter precursors that help us have more neurotransmitters, and then addressing her hormone issues. She started to have more normal conversations and a little bit better memory, and she was doing very, very well for about a year. And then, my brother calls me up and he says, well, there are too many pills for her. She was taking maybe 10 pills twice a day. But for her, from her generation, that was like, every time they take a pill, they think it's a drug, even though it's a food.
Right.
And then she got on other high blood pressure medications finally because they changed doctors, and the neurologist said, no, we better do that too. So they got her on other blood pressure drugs, which needed also a diuretic, which took fluids out of the body and not necessarily are, the end all. And she continued the same diet. I went to her house and she had cases of Diet Coke in the refrigerator. Diet Coke has something in it called NutraSweet. NutraSweet is called a excitotoxin. There's a famous neurosurgeon that wrote a book called Excitotoxins. And it's a poison for the brain, and it acts the same way as methamphetamine in the brain, which burns brain cells. Diet Coke, I've had a number of patients with pancreatic cancer. You look at what they're drinking, very often, for some weird reason, it's Coke or Diet Coke. There's something there, whether it's phosphoric acid, whether it's the colorings, whether it's the chemical of the sweetener. High fructose corn syrup is poison. It should never have been used. It's causing diabetes. It's causing in long run Alzheimer's, and it's causing many, many problems of the body. And it acts worse than just white sugar. It's even in a way worse. So what happened is my brother said, well, we're going to take her off the things you're giving her because she has to take these blood pressure drugs. And within 3 months, she was 3 times worse. And now that she's not taking anything natural, she's, in a pretty vegetative state. Wow. So we can see, that there are benefits, and that you have to look a little deeper to the cause. And very often modern medicine today doesn't have time to do that.
Right.
And that should be referred out to people like myself who spend an hour with a patient, each patient, and we all work together. This is the necessary thing now.
Well, this has been really interesting. We've learned a lot today about the connection between diabetes and Alzheimer's due to systemic inflammation and the underlying causes. Thank you so much for coming and joining us today.
Thank you for having me. It's been a pleasure. And, I really like doing this. And I'm in, Boston area every 6 to 8 weeks, and in California available for phone consults and, helping people as I can.
Great. Thank you for joining us on Living Healthy. I'm your host, Jackie Bell. If you'd like to know more information about Dr. Daniel Beilin, you can visit his website, fortifyhealth.com. Join us next time.